Can I have your attention, please? Thank you. It indeed is a great pleasure for me to welcome my old friend. He's not old, but an old friend, Professor Sriprasad. Him and me, we go a long time, isn't it? We've been colleagues together for some time. We have been members in the Past Council, recruitment societies and other things. And we both have a common interest, which is recruitment of the overseas trainees as well. He's put in a lot of efforts in academic research and urology. And more recently, he was appointed or elected into the Royal Society of Medicine chair of the section of urology. For all his academic work, he was also awarded with John Anderson Award last year in about. Thank you very much.
Mr. Hoja, Wasim, and Mr. Herman, my friends Subbu and Adel Makar, my friend for a long time, we trained together, Herman Fernando and friends. It is such a privilege and honor to be with you this morning to share some of the things as to how to survive, succeed, and sustain in the NHS. So what is my, next one for this. So, is it just moving the slide for some reason?
Yeah.
Okay.
Yeah.
So what is that? My kind of qualification to speak to you about how to succeed in the NHS and how to sustain in the NHS. I think most of it will feel like this. The managers, especially clinicians, we see them, and then the managers are just only for the next week, and then they move on. And when the weekend comes, they're off. As consultants, as that includes specialist registrars and trainees, and people who are top grade doctors, the BMJ says that we are the people of intense ambition. So we've got high intelligence, we've got focus and organization at work, and perfectionism. We want every operation we do should be perfect. And we thrive on stress. So we're always on stress, and then we do better and better stress. The adrenaline rush goes on and goes on. So we are high achievers by definition, by every doctor. So we are in the NHS to make it better. However, we also have other issues, for instance. So we've got high workload. Is there any doctor who says he's got less work in the NHS? Nobody, because there is a lot of work for them. And then, of course, with the COVID and the cancellations and then the harm reviews you're asked to do instead of operating, and then you are almost always agitated due to that. And to add to that, we all get complaints, and then somebody says something about us, which we get irritated about. And we always feel that the managers don't listen to us. Whom are we going to? The CD doesn't listen, the DMD doesn't listen, and things don't happen. So what's going to happen? So we're going to all miss in a frustrated situation, saying that I'm so good, I want to do this, but nobody is there to support me. And of course, not to forget about the paperwork. And we may have very nice colleagues, but we may also have some irritating colleagues, especially if your private practice is better than the others. And of course, we also, after all these things, we have to juggle our family life as well. We've got the spouses, and we're in a different world where both partners are working, we've got children. So it's a lot of things that there. In spite of all these things, how do you motivate yourself to do something good? And more importantly, how do you sustain and succeed in the next 25 years as a consultant? So these are the talking points. So what are the expectations of a consultant? How about the job planning is? And the NHS is ever changing. And working in the medical management and together, and also be part of the medical management. What about the NHS finances and the leadership and motivation? Although there are a number of these things, but I'm going to just focus on leadership and motivation. And also, let's go into this. How do you go into academia, for instance? The professional bodies, the exams, the NICE, and so on and so forth. And how do you get over through good times and bad times? And how do you deal with complaints and working with difficult colleagues and clinical excellence and awards and recognition? How do you do on to that? You can write a book on all these things, but we can't do that in 20 minutes. But I'll try and touch the important aspects of that. The most important of it would be motivation. And how do you get things done? Nothing happens in NHS in a straightforward way. You want a new thulium laser, you want something special, you want a robot. It doesn't just happen like that. And what is important to succeed is perseverance. If you just take one message from my talk today, this morning, and my entire kind of career spanning 25 years, is one word: perseverance. If you persevere, you will succeed. If you don't persevere, nothing will come into it. And of course, you need to also have the passion for progress. So every time, everybody has got the passion. You come out with lots of ideals as a new consultant, but then there are so many things happen, so you get suppressed and you get, just I don't care for any more things. I'll do my private practice, my family, and then go off. So as I mentioned to you, what is my qualification, other than I'm old and bald, to talk to you about all these things? I have been privileged to work in the multiple facets of urology that have been there. I started, here we got the vice president then, so we opened the Popular unit, which is award-winning one-stop cancer diagnostic center, and then you can see Simon Stevens here, and the local MPs. And we had a lot of talk about cryotherapy this morning, and I've got one of the largest series of laparoscopic cryotherapy in this country, and perhaps one of the largest in the world. And so initially I was going to talk on that, but then they said, better you talk on something more general because we got so much of local merit. That's fantastic. And you can see that they were talking about that nice, like a Christmas season, you can see the beautiful laparoscopic view of the cryotherapy. So we started the nephrology unit, and the whole cryotherapy was on patients' charity. And I'm most proud of what I've done so far is to have a regional stone center. And mind you, about all of us won't be lucky to be in a premier institution, to be in a really big teaching hospital. All my experience has been in a district hospital, and I've got a lot of my colleagues in here, my trainees in here, who were with me, were fellows, and they know what the situation is. And what is the message to give you is, if you have the inclination, and if you have the passion, you can do things wherever you are. So we've got 70% of us will be in district hospitals. About 30% or 20% will be in the premier institutions. Of course, they take it to a different level, but we will go into this place and make the place better than when we started. So this is the Stone Center with all its ramifications. And you can see here that not just the center, but we are the 5th highest doers of PCNL from the Gov review 2015 and 2020. We've got all the residential courses and master classes. And I've had excellent trainees. Ravi Barod was just in here, and then Wasim is here. You can see all the pictures. These are all who is who in this British urology. They were all kind of my trainees. And what also happened was that when I started as a consultant, within a couple of years, they said, this chap looks to be interesting, just put me as the R&D chair of the hospital. And when I saw the finances, the R&D finance was £39,000, which was less than the Kent ambulance service. I said, how can Kent Ambulance do more research than however the hospital is? And today it's got about 1.5 million budget. We got a large number of staff, and I've got lots of research fellows in here. Fahad Khan is here, who was one of my first research fellows. And then you can see so many people, my trainees, who have done extremely well. I think one of the things that yielded all this to happen was in the last Labour government, they made what's called the Comprehensive Research Network, so that from the ivory towers of research, it went to every part of the country. And very soon, there was about 250 million budget there to be taken to the various hospitals, because you've got NHR research, you can put patients into it, or you can also do your own research. So a lot of money came in, and today it's more than £2 billion. And the mission statement was clear, to support research and to make patients and the NHS better. And this is what I think has driven a lot of research from outside of the big centers like Birmingham and London, and it's gone to the periphery. Not that these centers don't exist, but we also complement and contribute from the periphery. And this is a message to everybody, whoever they are, wherever they are in the country. And we also found a new protein, not a new protein, but an old protein, NGOL protein, which is for ureteric obstruction. And this got the Hammersmith Gold Medal and was the best paper in the AUA. And one of my fellows, Marco, who is now a consultant in St. George's. We were talking about the cryotherapy before, and there was also this mention about a single kidney, and one of the largest single kidney series for cryotherapy function. And clearly, although you can see in this graph that there is the EGFR falls down significantly, but it doesn't harm any patient. The patient won't require any renal replacement therapy, and the same thing is mentioned in this. We did have problems of getting fellows. We had problems in the regions because, we're not a teaching hospital. We're so close to London. So then we had to come with some novel ideas, and we've made what's called Institute of Medical Sciences. And we started awarding the postgraduate MCH in urology. One of our boys in here also has done that. And this is a graduation picture in 2019. And this is the recent students. And also I was heavily involved in having our first Kent and Medway Medical School. So it started now, it's the first year of the medical school running all the way in Kent. As Mr. Oja kindly mentioned, I was also heavily involved with the BAUS. I was the BAUS section of endourology for 5 years. I was in the council, the BAUS section of endourology vice chair, and now I'm the chair. If Subbu is here, is going to follow me as the vice chair for the BAUS endourology. So I was an examiner for various courses and research degrees, and SAC member still, editor, and published more than 100 papers. All I'm saying to you, not just to say to you that it's not my CV I'm coming to present in here, but it's a very important point, is just to enthuse you guys to say, place doesn't matter if we have a will. That's all I'm trying, that's my only sentence to mention again and again. And of course, as was mentioned, I also got the John Anderson Gold Medal. And one of the main things that the people were very kind enough to write for a nomination was the inspiration. So that's a very important point. And not only that, and for all my effort I've done for the NHS in the region, I was even given the NHS Leadership Award in the 70 years. In 2018, 70 people were picked up, and I'm one of them, really privileged and honored to have the NHS Award, and I'm the Divisional Medical Director, and I was also a CD for a long time. I think all this happens because of you have supporting colleagues which you nurture and make the department, and then you make good appointments of your colleagues. You should never hesitate to make the best person possible to follow you or to be with you, because our days are numbered, and then we just move on in a few years' time, and who takes you forward is the best talent available, and there should not be any dilution on that fact. The planning, how you take to the next levels, and you also have to keep the management happy. Without supportive management, when I gave the presidential address for the RSM, our local MP, the chairman of the hospital, the CEO, and the medical director were all there to support me. So that should be the kind of a rapport you need to have with the management. And then, of course, in a supportive family is very important. We all know this, that in the meetings is a place where minutes are kept and hours are lost, and we all hate meetings. But we need to involve, because if you don't go into a meeting, then you are not engaged with it, whether the good or bad. And it's very important, however bad it is, and however the management are irritating, you need to be part of that. And never forget that leadership is a verb. Just because you're a leader, you can't say, I'm a leader and everybody follow me. Leadership, if you go by the definition, it is a verb. It is about action. It's not a position or entitlement, but what you're going to do is you take people with you and you're working with them. And there are a lot of fallacies and unrealistic optimism. If you are any of these, you can't become a leader in the NHS. If you're egocentric, if you're omniscient, saying that I know everything, you're omnipotent, none of them will matter. And don't forget that if you're going out and if you're laughing at people, when you come down, you have to meet the same people, as they say. So it is always better to know where you are, being humble and being with them. And one of the most important things is that the leadership should be non-hierarchical. This is what I've done in my little experience that I've been, that we are all caregivers, right from the porter, the cleaner, the chief executive, and we the surgeons. We are all caregivers. We all provide to the patient the same thing in different ways. The cleaner is the most important. Imagine a situation if somebody doesn't clean the toilets and the theater changing room for a week or so. And the most important is to have a collegiate decision making. Have all your colleagues together and say, this is what we want, guys, and how we're going to do this, and have a bit of a common sense approach rather than having a very complicated approach in leadership. Because I've not been to any of the King's leadership course or any of those things. One thing I've not done is gone for a formal leadership training. And another important thing I've learned is to acknowledge and appreciate your colleagues and your juniors. And you say, fantastically done operation, Tom, for this operation, or Hannah, anybody like that. So I'd be very careful because it would be, gender equality. So if there's a Tom, there is a Hannah as well. So it's important that you appreciate everybody, what they've done. Fantastic job done, excellent on-call. You were with me this weekend. We did very well. We did 10 operations, very nice. And then do the same thing for the nurses, do the same thing for the junior managers. Then that's very important. And never upset anyone, because you don't know whom you require for what. Because there is an ever-changing world in the NHS. You might upset this guy saying he's useless, and within about 2 years' time, he will come and see and sit you and say he's a dean of some medical school or something, and he will call you to see what you're doing. The next important point is to see the NHS budget. Although we saw, New Zealand beat us in the semifinals a couple of days ago in cricket, but NHS itself beats New Zealand in the GDP. You can see their budget of 2021 is 212 billion pounds is the NHS budget, while the New Zealand entire GDP is $202 billion. I'm just looking at the time. So, NHS is a huge body, and it's got a huge amount of money and manpower and the money. Where does the money goes? Money goes to a number of things, and we can see here in this graph, only about 2.5% of money is there for research and development. Although due to COVID, the good thing that's happened is there's money everywhere. This is the best time for you to go for new projects and the new business cases. Just a couple of words about business cases. So business case is a document an organization makes for the best possible decision. It means that the resources are there and the plans and forecasts for development is there. But what's important is that you should have, and I can give an entire talk on business cases, which I did in the class under urology. A single spend of anything more than £5,000 needs a business case. For very large hospitals, this could be defined slightly more, but anything more than £5,000, you need to have a business case. And then you also need to know that when we write a business case and then something doesn't get approved, you get very upset. But it's like going to the dragon's den. So if you're seeing other side of the table, you're seeing whether your states, you're outstated the benefits, whether thulium will replace PCNL, you'll write in your report. It says almost free is much less than holmium laser, understate the costs, and then you can make wildly optimistic scenarios which don't function. So the other side of it is to see the whole thing dispassionately, to see how things are. It's important, this is the kind of things you go to any kind of big project in the NHS or for any of the page where the taxpayers' money is involved, you got the Treasury 5-case model. So you should be a strategic case. Is this proposal needed? Is it value for money? Is it viable, affordable, and achievable? All common sense things, but this is what is called the Treasury 5-case model. So they'll always say, if you go to the managers, has it gone through the, have you done it as per the Treasury 5-case model? This is what NHS Elect wants it. It's what everybody wants it. So that's about the money. So let's go to the motivation, which is my main point of the talk. So to get motivated, you need to get opportunity, you need to have the determination, and you need to also feel that there's an incentive what you do. If you keep on asking the same thing and nobody provides, your incentive also has got only that much of a wavelength, and you will become bored about that. Motivation is what gets started, and the habit, they say, it's this old saying, what keeps you going. But this is true. There is nothing permanent in our NHS practice, for that matter, anywhere in any walks of life is change. You go on a Friday and you come back on Monday, you may not your office in the NHS. They'll say, we want some clinical space, we'll put you onto this, and another place where you got just a moving laptop and you walk around. Why do you need an office? So everything changes. You get new colleagues, new theaters, new equipment, and what we learned and what we're doing today, especially in my case, is different. We all did lots of open prostatectomy. That's what our learning, that was our main aim. And then that all went away. The laparoscopy came, the robotics came, the endourology went unnoticed. It was called, if you do a mid-ureteric stone, that was called the SHO's operation. You make a cut and do an X-ray the same day morning, and then you see where it is, and then you open it. All those things became thing of historical now. So all in about 25, 20 years and 22 years, the whole world has changed. And the second point, which I already mentioned, is that the perseverance. So if you persevere to something you like and keep on going at it, you will definitely get it. And we all know about King Robert, the Bruce story, how a spider made him to go back to Scotland and get back its crown. It's not just my words, it is. Steve Jobs of Apple, he says the same thing, that the difference between an achiever and a non-achiever is perseverance. The persistence, the patience, and the perseverance are the three things that are needed to keep us going in the NHS and get motivated. And this is what makes a mission impossible to possible. And we also know that the most certain way of success is always that one more try you give it. 10th time I've asked for a holmium laser and it's not happened. And then something will change. This is what Winston Churchill said. Success consists of going from failure to failure without loss of enthusiasm. There are good times and there are bad times. We all get, we'd say, I work so hard for the patient and see this person is telling me that has made a complaint against me. And then you get very upset about it. And then when you look through it, just take back. I think most of the problems, what happens is our reaction to the problem rather than the problem itself. And this is what a lot of people say. This CD is irritating me all the time, but you're giving too much importance to him. Just stay back and leave him alone. And if you don't respect him, then that person comes down. It's true for the other gender as well. So I'm very gender conscious. So there is good times and there are bad times. So, the bad times will come in, but, I think the amount of reaction we put for it is far more than the problem itself. And of course, you get a letter like this saying, the same day you get another letter when you're getting so much worried about they have to go for a coroner's inquest. Another patient says how good you were. And this actually, the mother has written for a son who's got a disability and due to the PCNL for him. Other point for you is that for all of you, for the new consultants and the consultants in here, to work on your strength. The most important of all the strength is clinical motivation. The day that you do a very good operation, whatever it be, then you feel so much more better in yourself. So clinical motivation for a clinician is the most important thing, not the managerial part of it, not building something part of it. A wonderfully done operation really makes you happy. That's true for everybody. Otherwise, you won't be doctors at all. And if you're a very skillful person, then you can do courses to show your skill so that people learn from that. And then if you're very good in teaching, then you go for teaching, TPD, college, etc. And then if you're methodical and then you've got lots of things to see the process, then you become clinical governance person, because just by doing a clinician, you will lose your motivation. You need something else going with it as well. Of course, if you've got lateral thinking and you know how to get grant, etc., you can do research. And it's important that progress, you assess everything by bite size. Every week, this week I've written a very nice complaint letter. Or I've done something now, I've finished my ARCP bit nonsense. So then you feel so much better. Then in monthly, you can have a nice paper, and then a year, you can have something bigger concept. So the weekly, monthly concepts, so there is some bite size, small things and small things, and small things become the big thing by the end of the year. So keep that in. And that'll give you recognition. That'll give you the excellence awards, which is so important for pension, etc. And also you get recognition in whatever sphere you are, whether you're an SPR, you will get a prize, or you've finished all your work, you finish your exam, or for a consultant, for anybody else. So you kind of keep moving in your goalposts, and then that keeps you motivated, because something there new to look forward to rather than the everyday's work. And don't forget circle of life. So we know the Simba story, we know the Lion King. So when the son is born, the father gets died and the son becomes the king. So you have to give it to the next generation. You have to get your SPRs, you have to get your trainees. They are your real asset. And looking them, how well they are doing for you. I'm seeing Ravi here, Wasim there, Fahad. They're just seeing them so well, for them doing very well. And the same thing in your own hospital. So bring them in, nurture them, and the department. So we are all temporary in this whole phase. And if we come do our act and we go away, that's what Shakespeare said. But the circle of life is very important. And this is a very nice book by Steve Peters on mind management, where all of us seem to have a chimp in our brain. So we get irritated, it's because of the chimp. So read this book. It's fantastic. It'll make you motivated. It'll make you, it's not just for philosophical old guys like me, but it is for all the elite sports persons as well. So this is the same chap who also advises the English cricket team, as well as the Tour de France things. Coming to my RSM year, I was president of the RSM this year. I gave started on the 14th of October. And then there is diversity of thought. So what is that I'm going to bring to the RSM? I mean, always everything has to be on merit, but coincidentally, I'm the first Asian president of RSM in 112 years. There's something, so there is some kind of history into that. Everybody brings different things to the table, and we are all important, and we're all capable, and that we need to get that, and diversity of thought. And more important is the diversity of action, the positions, for instance. I mentioned about my own situation. Joe Creswell is the president of the RSF to the BOWS next year. Nadine was going to become president of the RSM next year. So it's important that the positions also are taken by diverse groups. And no more manuals. So we've got a lot of things, and we've got multiple panels of diversity, gender, and other things, et cetera, et cetera. And also the location. So RSM has been very London-centric. So I want it to go away, not just from the home counties, but beyond. So one of the things I've done immediately is that the training is free for all trainees. So I kind of really request all the trainees to attend all these meetings. It's on only Fridays, so it's so that in your training day, and then you can register, and it's free for everybody, for UK and abroad. Anybody who is a student can get into it. The hybrid meetings, you don't need to come all the way to London, but it'll be at your doorstep. And if we can't do it for whatever reason that day, once you register, within 3 or 4 days, you can use it. You can see it again for a month. And global inclusivity is important. And how do we get? We got several industry partners to help us, so it's not going to be the cost. Another thing I'm doing is to link with so many different universities. The BAVS is doing the same thing. And Mr. Oja already mentioned about that. So it's important of this is that we can send our trainees to get trained. If you go to India, for instance, you will do about 50 PCR a week. So, that will kind of sharpen things, and they need so many things of what we know, the governance, the knowledge bit, we can give it to them. So it is an important export phenomenon. And this is the program. So I've already spoken to the program director, so to Herman, and we'll send all these programs. The most important of them is that we got Tom Liu coming on 10th of December. He's coming live. So it would be nice that if you guys can register, still there is time, which is a Friday, because Tom Liu of University of California, San Francisco, he is the one who invented the Liu's procedure. He's considered like the god of andrology. So he's coming in there. So there is people in every meeting, there are 2 or 3 international speakers. And the key issues in endourology meeting, which has been going on for about 6 or 8 years now, every other year, and it comes into my involvement in endourology. That's in February, and we also got a big medical legal meeting. Who is who in medical law? That's an entire day, right from consent process to the unfortunate thing if something goes wrong in our hands, what happens, the second victim, and so on and so forth. And of course, there is a winter meeting and lots of prizes galore for various. £2,000 is the minimum price, so the maximum price. So the first prize is £2,000. So I think I kind of again plead all of you to send your abstracts to all these meetings. And lastly, we think we do all the good things, but do mistakes happen in our hand? That is some of the humility that we need to have. And this is Rene Leriche, who is a very famous vascular French surgeon, who says every surgeon carries within himself a small symmetry where from time to time he goes to pray. So we've all done something, some wrongs have happened in our hands. And only we know that what have happened. And we all have mentally a small symmetry where we say, well, and I could have done better for this patient, Don't say I killed him, but I could have done a little more. I could have seen this patient a little more better. That's not just for consultant, it's for all of you. We all do various things. And lastly, ladies and gentlemen, thanks for your patient hearing. And let's finish with the surgeon's prayer, which says, give me work when I'm young. That's very good. Let there be no unexpected death on the operation table, because that's something that almost scars your mind. Let no swabs or forceps remain. It will become a never event. Be very careful about it. Let me not cross the point of no return during an operation. You can stop always and come back. But if you go beyond some things, then it may be a irreparable damage to the patient and for yourself. Let there be help in getting some critical situation, and never hesitate to ask your colleagues help when you're in trouble. Because nobody will ever think low of you if you ask somebody's help. They will be happy to come and help. And then your burden is, let's be selfish as well. Your burden will be kind of diluted, the problem. Let my skillful hands never be arrogant. Keep me away from temptations of money. That's very important. That's when the big departments are broken down, because X is earning so much money and Y is not so. Invisible enemies, the microbes, keep away from the patient, and give the wisdom to quit in time. If you say, I'm 67, I'm still working, do that, I'm going to do that. The patient still, my skill is bad, but still I'm going to do something just to keep myself as the head of the department. Those things that are fit for America, but not for British practice. Give me good health to enjoy the evening of life. Thank you very much.